RadioMD.
RadioMD.com.
Become a healthier you 5 days a week. This is Melanie Cole's Health Radio.
We've been hearing for years about the appeal of that financial bargain as many people sold on tourism plastic surgery, but then you've heard the horror stories about things that happened to people when they were in India or someplace getting plastic surgery that otherwise would have been more expensive here. My guest today, Dr. Robert Cohen. He's board-certified plastic surgeon with practices in Paradise Valley, Arizona and Santa Monica, California. Welcome to the show. Welcome back to the show, Dr. Cohen. So is plastic surgery tourism on the rise right now, or is it kind of coming down a little bit?
You know, I think it's hard to say because it's hard to keep track of who's going to other countries to have surgery. I do think there's probably more awareness now that trying to bargain shop when you're dealing with, surgery for your body or your face is not necessarily the best way to go because you may save money up front, but if you have a problem or complication, it can be much more difficult to deal with and much more expensive down the line.
I personally don't know why anybody would do it. I'd be terrified to fly to another country and not know ahead of time if their hospital is clean and if their doctors are board certified and if their doctors are really qualified to be doing it. It seems an awful leap of faith to me.
I mean, I think that's exactly the point. There's obviously very good plastic surgeons all over the world, but you don't know exactly what you're going to get. And usually when you start cutting costs, a lot of things that are getting cut are safety features. So, if you're having surgery in the United States, you have the FDA, you have a lot of different governmental agencies that regulate how plastic surgeons operate, the facilities, everything else to make sure that patients are safe. When you start leaving the country, you just don't know what the regulations are going to be, and you may have a very serious situation where sterility is not the same or the quality of the products that are being used are the same.
Well, sure, you come back looking like that lion lady or something, and then you can't really, change that. And so I think, and I thought, am I right in saying that like nose jobs, certain orthopedic surgeries, maybe full-on facelifts, these things people are going abroad for. And then do they come to you to fix whatever gets screwed up?
Well, that's the real problem. So if you go to another country to have a surgery and then the surgery is botched or something goes wrong and you come back to the United States, it may be difficult to find a surgeon who's going to take on this complication that they didn't start. So then you may end up having just to go to a hospital and get whoever is on call at the time. It's a very difficult situation to manage after the fact, and sometimes the surgeons in the U.S. won't know what was done or what materials were used in the foreign country, and that can make things even more complicated for patients.
Yikes. I mean, that just to me is definitely, and I used to do a travel show and we talked about traveling for plastic surgery and such, and even for, like I said, orthopedic surgery. And again, If you're getting a new hip, you go someplace where you know the guy and the doctor and you're like comfortable and oh my God, it's just sort of freaking me out. But so now people do get some decent surgery in other places. It can happen, right?
Point. There's some very good surgeons, but you just don't know for sure what you're going to get when you go out of the country. So, I always tell patients you only have one body, and if something goes wrong, was it really worth saving some money, and down the line it's going to be more expensive. Not to say you can't have complications with surgery if you have surgery in the United States, but at least if you have your surgeon here, you know where to go back to if there's a problem, and they can continue to help you versus flying out, coming back, and if you have a problem, who are you going to go to help, and they may not know what was even done. And I can tell you some crazy stories in a little bit that I've heard of.
Well, so I would like to hear a few, but first I'd like you to give some advice for people who say, I would like to have whatever it is done, breast augmentation, rhinoplasty, whatever it is, but I can't afford you, they might say, or my insurance isn't going to cover this, or I can't, so I want to look abroad. Then What do you say to them? And if they are going to look abroad, are there certain things like, do your surgeons speak English? And
Right.
I mean, are there things you want them to ask?
Yeah, I mean, I can't really address non-plastic surgery things since it's out of my specialty, but with regards to, let's say, what I see and hear of the most are patients going for cosmetic surgery out of the country. If you don't have the funds to pay for an elective surgery, then just don't do the surgery. Don't try to go to a less expensive place where you may be at risk for having a complication. It's not worth it. So, just take more time, save up over time, and then go somewhere where you know you're going to get quality care and safe care. And that's the most important thing, is safety. You don't want to put yourself at risk for something that's not absolutely necessary, or at least you don't want to put yourself at unnecessary risk.
Yeah, so, people always like to hear about bizarre things. So tell us some things that have happened.
Well, I've heard some stories and I've seen some things myself. So a couple of stories from colleagues. One patient went to Asia to have a rhinoplasty surgery, and he ended up doing a revision, and the graft that they used in the nose, when he pulled it out, was actually a disposable toothbrush that had been sterilized and placed in the portion of the nose. That was one story. I heard another story of a patient who went for breast augmentation out of the country, had severe capsular contracture, which is scar tightening around the implants, quote unquote. And when they went to take them out, they were actually balloons filled with birdseed. That was another one. And then I personally have seen a patient who had injections in the buttocks to make the buttocks bigger, and they were industrial grade silicone. The patient had severe infections. I saw her long after the fact, so now I'm treating her. She had these major scars and indentations in the buttock area where other surgeons had to try to take out all this material that got infected, and now she has a severe deformity that's going to be improvable but definitely not fixable. So those are just a few examples of some of the things that can happen. And then, just on a less crazy standpoint, you can just have patients with routine complications, but then they don't know where to go to get the complications handled because their surgeon is in another country, and now they have to start looking for somebody locally. And obviously, surgeons don't generally want to take care of complications from somebody else's surgery. So it becomes a very difficult situation for some of these patients.
Well, and also I think that, while you may think that the financial, bargain is there may be hidden costs that they don't tell you about, but that here you guys have to be very upfront with every single thing that we're going to have to pay. And we're not going to find out after the fact that you're charging us for, something that we didn't sign off on. Whereas over there, they can keep you there and say, well, you still have to pay for this, this, and this.
And that's certainly possible. And then more so than that, I always tell patients fixing complications is a lot more expensive than doing something right in the first place. So I think where the cost issue comes into play is if they have surgery at a lower cost but then have a problem, now it becomes a much more expensive and difficult process than it would have been if they just had the surgery done properly and safely in the first place.
Yeah, so do you happen to have in your wheelhouse there any countries that you would tell people, I don't know if I would go there for my plastic surgery?
Well, I mean, it's not like anything specific to a country. I see a lot of patients just because of my practice being in Southern California and Arizona. There's a lot of patients going into Mexico to have surgery. And again, there's some excellent Mexican plastic surgeons, but it's hit and miss, and you won't always have the same regulations that you do in the United States. Same thing with South America, some excellent plastic surgeons there, but you just never know what you're going to get. I hear a lot of patients going to Thailand, other places like that. So it's just a it's a little bit of a gamble. And why would you want to gamble with your body? You only get one of them. So always safety and quality should be the number one priorities. Number two priorities when you're considering elective surgery.
Absolutely. Now, we only have a minute left. So first, tell people where they can find out more about you, and then give your best advice, Dr. Cohen, about what they should look for in a plastic surgeon. We only have 1 minute.
Okay. So if they want to find me, my website is www.drrobertcohen.com and www.robertcohenmd.com. Those are my California and Arizona websites. My best advice is make sure your surgeon is board certified by the American Board of Plastic Surgery. Go to the website, make sure they have lots of before and after photos, and check those photos and make sure that you like what the results are. Meet with the surgeon in person, make sure you connect, and then make sure you're on the same page. And also make sure that the surgeon is always putting your safety and your well-being as the number one priority.
Absolutely great advice. Thanks so much for being with us again, Dr. Cohen. And remember, if you missed any of this great information, you can listen anytime on demand or on the go at radiomd.com. And his is drrobertcohen.com and drrobertcohenmd.com. And boy, you should ask those questions and reconsider going abroad for plastic surgery, because it could be quite scary. And if you missed what he said, listen again, because boy, he gave some interesting little stories. This is Melanie Cole. Thanks for listening, and stay well.